Every workplace accident, illness, or dispute carries a cost, not just for the organization, but for the individuals affected and their families. These incidents can disrupt lives, strain relationships, and impact long-term well-being. That's why creating a safe and respectful work environment isn't just a policy, it's a responsibility. When we prioritize safety and care, we build trust, reduce risks, and foster a culture of accountability. A safe workplace leads to a healthier atmosphere, stronger morale, and improved productivity. Let's commit to making safety a daily practice, for ourselves, our teams, and the future we are building together.
Health, safety, and security are essential pillars of a productive and respectful work environment. Health focuses on the physical and mental well-being of employees, ensuring access to clean facilities, medical support, and stress-free conditions. Safety involves preventing accidents and injuries through proper training, equipment, and hazard control. Security protects people, property, and data from threats like theft, violence, or cyber attacks. Together, these elements foster trust, reduce risks, and support both individual welfare and organizational success.
A health, safety, and security policy is a formal written declaration made by an employer that outlines the organization's commitment to protecting the well-being of its employees and the public. This policy serves as a foundation for creating a safe and supportive work environment.
The policy typically includes guidelines, responsibilities, and procedures that help identify risks, respond to emergencies, and promote a culture of safety and accountability. It also demonstrates legal and ethical responsibility, showing that the organization values its people and the community it serves.
A workplace safety policy serves multiple important purposes. First, it reflects the company's strong commitment to the health and safety of its employees, showing that their well-being is a top priority. It also demonstrates that business performance and safety performance go hand in hand. Safe workplaces support efficient operations. Such a policy sends a clear message that the company values people, not just profits. It outlines the responsibilities of all employees, ensuring that everyone is accountable for maintaining a safe and secure environment. Additionally, it helps the organization comply with the Occupational Health and Safety (OH&S) policy of the Government of India, aligning with national standards. Most importantly, a well-implemented safety policy helps prevent workplace injuries and illnesses, protecting both individuals and the organization.
A hazard is any source or situation that has the potential to cause harm, whether it's to people, property, or the environment. Hazards can be physical, like machinery or slippery floors, chemical, like toxic substances, biological, like viruses, ergonomic, like poor posture, or psychosocial, like stress or harassment. Identifying and managing hazards is key to maintaining a safe and healthy workplace.
A physical hazard is anything in the environment that can physically harm someone. Common examples include slippery floors that can cause falls, sharp tools that may lead to cuts, and loud noise that can damage hearing. These hazards are often found in workplaces like factories, kitchens, or construction sites. Identifying and controlling physical hazards is essential to keep everyone safe and prevent injuries.
A chemical hazard at the workplace refers to exposure to harmful substances that can cause health problems or injuries. These include acids and corrosives, which can burn skin or damage eyes, fumes and vapors, which may cause breathing issues or dizziness, toxic chemicals, which can lead to long-term health effects if not handled properly. Proper labeling, ventilation, protective gear, and training are essential to reduce chemical risks and keep the workplace safe.
Biological hazards are harmful organisms that can cause illness or disease in the workplace. These include bacteria like those causing food poisoning or infections, viruses such as influenza or COVID-19, fungi and parasites which can lead to skin or respiratory issues. These hazards are common in healthcare, laboratories, agriculture, and food services. Proper hygiene, protective equipment, and sanitation are key to preventing exposure.
Ergonomic hazards are risks that arise from how work is physically performed. They include poor posture, sitting or standing incorrectly for long periods, repetitive movements, doing the same motion over and over, like typing, uncomfortable workstations, desks or chairs that don't support the body properly. These hazards can lead to muscle strain, joint pain, and long-term injuries. Proper workstation setup and regular breaks help to reduce these risks.
Psychosocial hazards are risks that affect a person's mental and emotional well-being at work. These include stress caused by high workload, long hours, or unrealistic expectations, harassment such as bullying, discrimination, or verbal abuse, workplace violence, threats or physical harm from coworkers or others. These hazards can lead to anxiety, burnout, or reduced job performance. A supportive work culture, clear policies, and open communication help prevent and manage these risks.
Electrical hazards, risks from exposed wires, faulty equipment, or overloaded circuits that can cause shocks or fires. Fire hazards, flammable materials, open flames, or poor wiring that may lead to fire outbreaks. Health hazards, conditions or substances that can harm physical or mental health, like poor air quality, noise, or stress. These hazards must be identified and controlled to ensure a safe and healthy workplace.
In any organization, hazards can come from various sources that pose risks to health, safety, and security. The workplace environment itself may be hazardous due to poor lighting, slippery floors, or extreme temperatures. Machinery and equipment can also be dangerous if they are faulty, unguarded, or improperly used. Chemical substances like acids, fumes, or cleaning agents can cause serious harm if not handled correctly. Biological agents such as bacteria, viruses, or mold may lead to infections, especially in healthcare or food-related settings. Human factors like stress, fatigue, or lack of training can result in unsafe behavior. Fire and electrical hazards, including exposed wires or flammable materials, can lead to serious accidents. Ergonomic issues such as bad posture or repetitive tasks may cause long-term physical strain. Lastly, security threats like theft, workplace violence, or cyber attacks can disrupt safety and well-being. Identifying and managing these sources is essential for creating a safe and productive work environment.
Hazard control refers to the methods used to eliminate or reduce risks in the workplace to protect employees, equipment, and the environment. It begins with elimination, where the hazard is completely removed, for example, replacing a toxic chemical with a safer one. If elimination isn't possible, substitution is used to replace the hazard with something less dangerous, like using non-slip mats instead of slippery flooring. Engineering controls involve physical changes to the workplace, such as installing machine guards or improving ventilation. Administrative controls focus on changing how work is done, including rotating tasks or providing safety training. Finally, personal protective equipment, PPE, like helmets, gloves, and masks is used as a last line of defense. Together, these measures help create a safer and healthier work environment.
To maintain a safe and healthy workplace, employees should follow essential safety guidelines. Store cleaning chemicals securely in separate cupboards, dispose of garbage daily, and ensure proper lighting in all areas. Avoid wearing loose clothing or jewelry when operating machinery, and never distract others working near fire, tools, or equipment. Use protective gear like goggles, gloves, masks, or hair nets when required, and shut down machines before leaving. Electrical safety is crucial. Never tamper with controls, repair damaged wires before use, and avoid equipment that sparks or smokes. Operate machinery only after proper training and supervisor approval. Maintain hygiene by covering food properly and respecting no smoking zones. Lastly, report any unsafe conditions or actions to your supervisor to help prevent accidents and ensure everyone's well-being.